Hey, it's Nurse Key here, and welcome to the New Nurse Bootcamp. So today I want to talk to you about the New Nurse Roadmap. Did you know that a new nurse is considered anyone practicing within their specialty within less than 1 to 2 years? So I feel like that takes a little pressure off. You have about 1 to 2 years to actually master your specialty, or at least to get the fundamentals. And I kind of want to show you what the roadmap of that may look like from starting the job to that 1 to 2 year mark of where you should be. So starting with like day one, we know that we passed the NCLEX, we finally got our job, we're getting ready to start. So nurse residency, or your nurse orientation period. All hospitals and facilities do not do this all the same, of course, but every nurse should have some type of orientation period. Whether you're in a skilled nursing facility or a SNF, that may be 2 to 4 weeks. In the hospital or acute care, Med-Surg tele, it may be 6 to 9 weeks, and then critical care, ICU, maybe 8 to 12 weeks. So within that period, you're going to be assigned a preceptor. In nursing, the joke is they may be voluntold, but you will have a preceptor, which is like a little bit more advanced nurse that will be able to guide you in some of the unit policies, your clinical skills, and help with critical thinking and prioritization. So you'll generally have like one or two, a few shifts to shadow your preceptor. So I don't want you just to shadow them to see, okay, we have these patients. You kind of need to watch to see how they actually set up their day, how they receive handoff, how they go through the chart, how they structure their time, and how they manage each patient load. A lot of times nurses think in their heads, so don't be afraid to ask questions at the appropriate time, which would be while you're sitting at the computer, you have downtime. Ask him, hey, okay, so why did we go into this patient's room first? Or what about this medicine? Or when a new order comes in, how do you prioritize that based off of what else we have going on with other patients? So questions like that help you gain some insight of how a skilled nurse thinks. So your preceptor also is there to close knowledge gaps. So we only learn so much in nursing school, and generally that's in a controlled environment, and then you get into the real world and it's nothing controlled. So now your nurse is able to see in real time how you can manage your skills, what these disease processes look in real humans, and how you can manage those while collaborating with your team. So you have your preceptor, and then you're gonna shadow, and then you're gonna have your own patient load. So depending on what specialty that you choose, if it's skilled nursing facilities, you can have anywhere up to 30 patients at a time, depending on what state and shift that you work. Generally